help combine both worlds, healthcare and community, so we can make everybody have a safe summer, be able to go out and enjoy all the activities that they want to enjoy while staying safe, as well as help our healthcare workers know about injury patterns, know about how to educate and teach their patients about injury prevention. So I'd love for you guys to shout out in the chat. We'll do this as a poll as well, but shout out in the chat, just say where you're from, where you're watching from today. Tell us who you are. We'd love to say hello to everybody. And then I'm
gonna launch the poll.
We'll watch the poll as we go through this. So just looking at, again, there's no disclosures. Myself, I forgot Linda's here as well. So Linda works with the Office of Network Development and Telehealth, and she's been helping collaborate with us on this. So she helps us put this together. She's running the polls, and was their nurse educator as well there for our affiliate hospitals. So just so you know, we all have no disclosures. Ty and Kylie don't have any disclosures to let you guys know of when we do this presentation. All right. Lots of nurses, some other clinical staff. Fantastic. Also to let you guys know of our upcoming, the finishing of the series, we've got boat safety on July 14th, motorcycle safety on July 28th, and then fall safety on August 11th. We'll finish out the summer learning series, and then hopefully in September, jump right into fall. We're kind of going to focus on hunting and outdoor safety in the fall. Utah's a big hunting state. I grew up with a family that was hunting all the time, so we want to make sure that everybody is doing this or is safely doing all those activities as well. So please join us for those. I'll be sending out flyers. Also on our social media, so at U of U Trauma for Twitter. I also post these on LinkedIn. If you follow me on LinkedIn, we have a Facebook page for U of U Trauma, and also an Instagram page with University of Utah Trauma. So please go ahead, and you can also, if you follow us on any of those social media sites, we also post the registration there. For those of you that are healthcare workers and are looking for contact hours, just to make sure that you guys know what to do to get these contact hours, obviously you need to attend and participate in the presentation, complete the end of presentation polling. You get 1 hour contact awards, and then the certificate is sent out within a week, and you can use for your professional licensings. EMTs, sometimes usually your training officer has to approve these, but you still have that contact hour that you can add to that. So just let you guys know that we'll be emailed out within a week. So when you registered, if you clicked on yes, you want contact hours, we'll make sure that's sent out to you. I also say, please go ahead and share with me any new topics you might want to hear, any education requests you might want to hear. While I have everybody on here, I'll let you know that we also have 2 trauma grand rounds coming up in July on emerging trends in EMS. It might be a good thing to know what the hospitals know about EMS practice, especially if you're the EMT, nurses as well, just to know what people are bringing in and what's happening in the EMS world. And then we have a neuro, which I can't pronounce what he calls it. We have a neuro grand rounds on the 30th, talking a little bit about brain death and what happens when you declare a patient brain dead and then they start showing signs of life, like they have brain reflexes. So go ahead and join us for those 2 as well, and I'll be sending out information about that. And then this is just another thing. We like to share tips and tricks for injury prevention. So the University of Utah Burn Center has a crisis standards of care website where you can sign up, and it's only healthcare workers can sign up and get access to this site. And it's got some great resources for taking care of burns, for EMS and burns, kind of emerging trends. Annette Matherly is their outreach lady, and hopefully you've met her, and she is fantastic. And she also said that all 50 states kind of collaborate on this, as well as, Linda, did you say 10 other countries?
Yes, they're from all over the world.
All over the world kind of help put this site together. So please go ahead and you can also look on that, standards of care. So I'm going to end this slideshow.
And I don't know if you can see the results of the poll. Are you all able to see that? Or should I share my screen?
Linda, go ahead and just go over that if you want to.
Sure.
And
So it looks like we've got 58% are RNs of those who completed the poll. Other clinical staff are 42%. It looks like we've got Wyoming and Utah, and I haven't seen the other two people are in a different state, but excellent, Utah and Wyoming. And if you're from another state, put it in the chat and we'll take a look. And then have you or anyone you know been in a water accident? And it looks like 42% of you have had somebody, and 58% have not. So it should be really an interesting presentation for you. And again, the goal is to make sure that you have the information that you can then help and work with your your patients and community members.
yes.
So go ahead. Thank you very much for completing that poll.
Fantastic. All right, you guys, so just a little housekeeping items on Zoom. If you haven't used Zoom before, just go ahead and keep yourself muted. But if you have questions, please go ahead and take yourself off mute, pop in, ask the presenters questions, or put something in the chat, either to the group, or you can put something privately to myself or Linda, and we can ask. You could put something privately to anybody in the chat box. So go ahead and utilize that. Like I said, take yourself off mute. We want this to be interactive. If you're comfortable enough to take yourself off, or put yourself on camera so we can see everybody's faces too, that's fantastic. If not, that's okay. So today we have Ty Hunter and Kylie Bytendorp. I said that right, Kylie? Your last name? Okay, I'm just going to give them a quick introduction. How this is going to go today is Kylie's going to start her presentation, and then we're going to leave it open for questions for her at the end. Again, if you have a question during her presentation, feel free to pop in and ask or pop in the chat. And then we're going to have Ty go ahead and present. And then same thing, go ahead and ask him questions, and then we'll kind of leave it open at the end for question and answer for everybody. Again, we love being interactive, and this is a learning environment for everybody. So please share, ask questions, all of that stuff. I am going to give them a quick introduction, if you can hold 1 second. All right, so Miss Kylie, she is a critical care nurse at the University of Utah Hospital and has spent the last 3 years in the surgical ICU treating surgical emergencies, transplant patients, and trauma patients. She also works as a wound care consult nurse and teaches Stop the Bleed for groups around the Salt Lake Valley. I gave her a heads up for that. She's one of the first person that always jumps in to teach. Kylie originally began her healthcare career while studying public health at Utah State University. She became a wilderness first responder and guide for the USU Outdoor Recreation Program and went on to graduate with a bachelor's in nursing from the University of Utah. She is an outdoor enthusiast, an avid skier and trail runner, and loves going to the mountains with her family. So thank you, Kylie, for being willing to present today. And then to tell you a little bit about Ty. Ty was born and raised in Plain City, Utah, and graduated Weber High School. He obtained a Bachelor of Science in Recreational Resources Management at Utah State University in 1997. He started his career with the Utah Division of Parks and Recreation in December of 1997 as a park ranger at Willard Bay State Park and was promoted in October 2002 as the assistant manager at Yuba State Park. In June of 2003, he became the park manager at Utah Lake State Park, and after 10 years of service as a park manager, was promoted to the current position to the boating program manager for the Utah Division of Parks and Recreation and boating law administrator for the state of Utah. Over his 22-year career, he's observed many water-related incidents that resulted in the loss of life. He has interacted with many families and seen the hurt and loss of a loved, or I can't even talk today, sorry, the hurt that the loss of a loved one causes. This is why he is passionate about water and boating safety and hope that during his efforts to portray life jacket safety, that at least one life can be saved and their family will not need to experience loss. When he's not at work, he enjoys being with his family, participating in a variety of outdoor activities, playing games, and tinkering around the house. And Ty will also be joining us for boat safety in the next 2 weeks. So we're excited to have him for that too. So for this, we'll turn it over to Kylie and let her get started.
Okay. And Ty, did you have a preference of presenting first or not, or is that going to throw off our the flow of things? Okay.
No, go ahead. That's just fine.
I was going to say, if you guys had this worked out and Ty wants to go first, whatever you guys worked out, we're good to go.
Okay. All right. Well, I'll go. I think we'll have some things that'll kind of overlap, so it should work fine either way. So I'll go ahead and share my screen and open up this presentation here. Okay. Okay, great. Well, I'm excited to be with you guys today talking about water safety. And so kind of how I kind of have this set up is kind of going over different kind of water related injuries, kind of talking about what those injuries are, kind of like what we would expect to see, and then talking about kind of like a first responder response, kind of pre-hospital stuff, and what to do if you're witnessing witnessing one of the water related injury happen. So just kind of some water related injuries. So things that wanted to touch on. We'll talk mostly about drowning, because that you can see in kind of any water related event, from rivers, lakes is kind of our main focus, but then also pools as well. And then spinal injuries, pretty popular to be like cliff jumping here in Utah. I know there's some popular lakes that have cliff jumpings. Just wanted to touch on that as well. Hypothermia, because our lakes in Utah are normally snow water runoff, and those can be pretty dang cold. And then also ice fishing is popular in certain spots in Utah as well. And then we'll just kind of briefly touch on heat-related injuries and sunburn, just because it's something that you just don't normally think about with water-related injuries. And so we'll just kind of talk about that shortly. And then this is, I just have a picture here. This is actually me. This is up on the Snake River in Wyoming. And that's something I love to do with my family in the summer, is get out on the river. And just as we're out there, we always make sure that, luckily I'm a nurse and I've been on this river a couple of times before, but we always have our PFDs on. And then we have a rescue system in place for if someone does go over and swims through a rapid. So we'll quickly talk about just kind of some heat and sun injury kind of things, just because it's something you don't typically think about when you're on the water. You don't think about drinking water usually, and that can lead to dehydration and heat problems if you're not in the water enough. So if you're kind of lounging on the beach on the side of a lake, or if you happen to travel out of state and go hanging out on the ocean, you're not getting in the water enough. If you're on a boat and you're not getting in the water and just sitting in the heat, you can kind of start to see some of these symptoms. So heat exhaustion, it's kind of a continuum from heat exhaustion that goes to heat stroke, is how it's defined. I got my definition from the CDC. And so you'll see with heat exhaustion, you'll start to see sweating, headache, irritability, dizziness, sometimes lethargic. Someone will have fatigue, start feeling tired. And then it starts to get pretty bad if you're getting nausea and vomiting. And if the recommendation is if you're vomiting and you can't hold down liquids for more than an hour, you definitely need to seek definitive care and to see a healthcare provider. And then heat stroke is defined as greater than 105 degrees Fahrenheit. And usually what you'll see with that is kind of more hot, dry skin, because your body is no longer able to compensate and regulate for that temperature. So sometimes people will have dry skin and are no longer sweating, and it'll be super hot. And you'll start with like the headache, irritability, dizziness, and lethargy. That'll lead to confusion and then eventually unconsciousness. And then that's when you really need to seek definitive care there. So some ways to prevent this: sweating a lot. Some people get like really flushed red cheeks. And so with that, we need to make sure that people are resting. They're not running around constantly. Finding shade, drinking water, encouraging kids to drink water because they're busy playing around, making sure that they're drinking lots of water. And then if you are feeling these symptoms and maybe you're on a boat and haven't been in the water in a while, go jump in the water, get a hat and soak the hat in water and put it on your head. These are also good tips for hiking around the Salt Lake Valley as well. I always make sure to have a hat with me so that if I pass a stream, I can soak my hat in water and cool off my head. It just kind of keeps your whole body nice and cool to prevent any of these other symptoms from happening. And then once you get to the heat stroke stage, kind of more advanced care, you want to try to do evaporative cooling. So this something that we'll probably go even, you can go even further to cool people down once you get to hospital emergency room stuff. But evaporative cooling is when you want someone like with a wet body. You don't want to use like ice cold water because that'll cause vasoconstriction, but kind of more like lukewarm water. Try to cool someone down, make sure their body's wet, and then use fans to cool their body off so that they have that evaporative cooling method. Try to cool them off. And then in the emergency department, I believe, let's see, I think, well, more so they'll use like warm fluids if someone is hypothermic, but for heat exhaustion, you can use fluids, the intravenous fluids, to cool someone down as well. And then this is definitely someone who's going to be very critical and needs to go to the hospital right away if they've gotten to the point where they're confused and hot and their body's not sweating anymore. So that's, yeah, definitely needs definitive care. So, and then just to quickly touch on sunscreens here, we have some blistering second degree burns over here on this picture. So just always push sunscreen for anyone who's outside. Sunscreen, wait to get in the water, wait for the sunscreen to actually absorb before getting into the water. And then covering up, using hats, using long sleeve for especially kids who have like fair skin, because they're less likely to be reapplying and kind of monitoring that. So covering up skin works even better than sunscreen usually. And then sunglasses as well, especially if you're on a lake, on a river. That reflection from the water is going to be coming straight into your eyes and can cause eye irritation. If that does happen, you need to go to an eye doctor, and there's like certain eye drops that they can prescribe to help with that irritation there. But the best prevention is just wearing sunglasses when there's water reflecting into your eyes. And then for treating sun safety, if it's just red and irritated, you can just use a moisturizing lotion. But if it's blistering, important thing to remember is not to break the blisters. I'm a work part-time as a wound care nurse as well, so like we pick at blisters sometimes and open them, but for the most part, only in certain circumstances do you actually open them. For the most part, you don't want to break those because that just leaves non-intact skin that is much easier to get infected. So leave them covered. In the hospital, we use Methylex to cover blisters because it's something that's it's easy to take on and off. It's not going to stick or pull on the skin very much. But kind of anything that's non-stick that is used to cover it. You can also use kind of something cool to kind of help with a pain relief. And then if the blisters do open on their own, applying bacitracin, something with some kind of like topical antibiotic, polysporin, those can be used to help kind of treat those as well. And then just keeping them covered, keeping them clean. Those are all good to help kind of with those bigger blisters there. Okay, so now let's talk a little bit more about drowning. So drowning, you can find multiple definitions of drowning online, and then you'll hear a lot of times of a near drowning or a secondary drowning, wet versus a dry drowning. But really in 2002, the World Congress on Drowning, they kind of clarified the definition of this and said that drowning is a process resulting in primary respiratory impairment from submersion in a liquid medium. So it kind of helps to just clarify that definition so that there's not 20 different definitions of what drowning is. Drowning is any kind of process in that respiratory impairment that happens when someone is in a liquid. So whether it's just kind of like going under, coming up, coughing, having difficulty breathing, that is still considered a drowning versus someone who goes into cardiac arrest from being submersed. Both of those are considered drowning. So, and this helps to, just kind of clarify the definition, helps to clarify kind of how we treat it. We treat all of them pretty much the same. So, and just that one of the a big misconception of drowning is that the problem is that the lungs are full of water and can't have gas exchange, but really the problem is just a lack of oxygen to the brain. So it's just that there is no oxygen circulating in the system to get to the brain, and that's when people become unconscious and then eventually go into respiratory arrest and cardiac arrest. And then effects of drowning can be felt up to 24 hours after the initial submersion. So this is kind of in river rafting, this is sometimes known as a parking lot drowning, or it was previously known as a secondary drowning. So someone who, if you're on a river trip, someone who swims a rapid, let's say they were under for a while, they can get out, feel fine, and then a couple hours later, 4 or 5 hours later, when you're in the parking lot, they all of a sudden have this increased dyspnea, difficulty breathing, they're wheezing, and what has happened in that case is that pulmonary edema has started to set in from that irritation from swallowing water into the lungs. And so you'll get that swelling and irritation in the lungs there. And that's that is still considered a drowning episode because it is based on the fluid that has irritated the lungs, and that does need to be treated right away with definitive care, going to an emergency room and seeing a healthcare provider to treat that. Oh, and then I have this picture of a water bottle here because just to kind of drive home the point of like that drowning is not your lungs being full of water, because actually you only need 1 to 3 mils per kg of water to cause irritation to the lung lining, to cause irritation to the pulmonary system. And so it's actually a pretty small amount. So this is an 8-ounce little bottle of water. And so with the 1 to 3 mils per kg, so this would be a 3 mils per kg of someone who weighs 70 kilograms, so like 155 pound person. They would need a little bit less. They probably need about 7 ounces of this water to cause harm, or maybe even less. They could need like 70 mils of water. So it's a very, very small amount that can cause the symptoms of drowning and cause respiratory distress. So you just kind of don't take it lightly if someone does have kind of like a drowning episode. If you're thinking that it's like, oh, they couldn't have swallowed that much water, but you don't actually need that much water to cause problems. All right, so then just kind of split this up into 2 different ways to manage someone who is conscious and talking to you, and then we'll talk about someone who is unconscious. So, and this is kind of written as like a first responder kind of thing. So someone who witnesses this happen or sees someone who is struggling in the water. The first thing you want to do is make sure that before you go and try to rescue someone, that it is a safe area. If you're on a river, there's not rapids coming up soon that you would have to swim. Making sure that if you are going in the water yourself, you are a strong swimmer. That maybe it's for a child, making sure that it's not deep, that where maybe you can stand up but the child can't. So just kind of assessing that area there, and then also kind of normally if someone's drowning, they're kind of panicking. If someone is to go into the water after them, they can then cause the other person to go under the water as well, and because they're so panicked. So one of the ways you can help with this is this is a rescue throw bag. And so this is a rope that you throw. Someone can grab onto the rope or grab onto the bag, and you can pull them to safety. This is a way to just kind of help protect yourself so you don't become a second victim that now someone else has to go and save both of you. So as long as you don't become a second victim, this is a good way to help kind of prevent that. So let's see. So other things to consider when managing someone who looks like they may be drowning, looks like they may need help. Do they have other injuries that you should be aware of if you're trying to get them to a safe area? Did they just jump off a cliff and now they're kind of floating and not really moving in the water very much? You can hear them talking, so you know they're conscious, but maybe they're not moving very well. Could they have injured their spine at all? So it's just kind of something to consider. Obviously, it's more important to get someone to safety than to leave them in the water and not touch them because you're worried about a spinal injury. Scene safety first, making sure that that person is safe as well as the rescuer is safe, so you're not sitting in the water. But it's kind of just something to be aware of, so being gentle when moving someone, and then kind of as soon as you can be in a safe area, making sure they're not moving their neck or moving their head, and that they're laying down flat. And we can kind of look at some pictures of full spine as well. So just kind of just managing that, seeing if there's any bleeding going on. Did the person fall off the boat and cut their leg on the propeller on the boat? Did they get sliced by another boat while they were in the water? So kind of managing, you have to kind of manage all the things and see kind of which is the most life-threatening to begin with. Obviously, getting them to safety is the most important thing, but then you might have to manage some bleeding issues or some spine stability issues. And then keeping this person warm. Cold water, we'll see this on a couple slides, but cold water is considered anything less than 68 degrees Fahrenheit. And most of our lakes here in Utah have a lot of snow runoff. They can be pretty dang cold. A lot of the rivers too are pretty cold. So keeping this person warm so that hypothermia doesn't set in and add kind of more problems, make sure they're not shivering. A good way to do that is to get rid of wet clothing and put them in dry, warm towels or blankets, something that's dry. And then kind of the symptoms that you would see with someone who's symptomatic from a drowning, they'll have difficulty breathing or dyspnea, coughing, wheezing, chest pain or chest tightness. And then you may also see like an altered level of consciousness. So maybe they're lethargic, fatigue, maybe they're a little confused. All those things are, if anyone is symptomatic after drowning, that's a time they need to see a healthcare provider, probably need to go to the emergency room and be seen by further care, because again, because the pulmonary system has been irritated and is going to get inflamed, these symptoms could get worse over a 24-hour period. So they need to be monitored if they're having symptoms. And then if someone is asymptomatic after they've had some kind of issue where they were submersed under the water, you still need to monitor for 24 hours just to make sure that those symptoms don't come up again. So so like if they're asymptomatic, don't need to go in, but still need to be monitored for any of these symptoms that come up, and then they need to see a healthcare provider. And then infection risk too. If you're swallowing lake water, swallowing river water, or nasty pond water, these are all sources of infection that could end up in the pulmonary system. So those, they might need to be treated with antibiotics. If you're swallowing any kind of like microorganism, is not good for your lungs. So kind of watching for signs. Obviously these wouldn't set in immediately. These would be maybe within a week, but watching for signs of infection like fever, chills, anything like that. It could be something that they swallowed. And this can also cause further irritation to the lining of the lungs. And so you might see these other kind of drowning symptoms, the dyspnea, chest pain, chest tightness, cough, pulmonary edema. Those things can still come up if there's a secondary infection that happens. Okay. So management of an unconscious victim. So this is someone who's in the water, who's not swimming, not moving on their own, that you see. So again, scene safety, super important. Make sure you don't become a second victim. And if someone is unconscious on the water, definitely like 911 needs to be called right away. Get more help there immediately. And then kind of the most important thing for this person is going to be rescue breaths. Some of the studies that I was reading were saying that to do rescue breaths in the water, even before you get them out of the water, just be doing that. That can be a problem for someone who's not a strong swimmer, or if you're having difficulty reaching that person. So as like a first responder, you kind of just have to gauge. You may just have to gauge your own skill. And if you're not comfortable doing that in the water, don't do it. It's better to just get them to a better spot where you can do more effective rescue breaths. So, and for a drowning person, it is like the rescue breaths are going to be really, really important. CPR is also very important, but the idea behind CPR, if you're doing CPR without breaths on it, is you are assuming that that person already has oxygen in their bloodstream that is circulating, and so they have a couple minutes worth of oxygen in their system ready to go. Someone who was drowning, who has been underwater, they have not been taking in any oxygen, their oxygen saturation is dropping from 90s to 60s to 40s, can be down to 0 by the time you reach someone who is unconscious. Those people don't have any oxygen in their bloodstream to circulate, so they definitely need rescue breaths right away. And we kind of have moved away from breathing with CPR because they said the most important thing is to do chest compressions, and that's not the case if drowning. And even the American Heart Association has kind of made some disclaimers on that drowning is an exception to that. So making sure that you have rescue breaths, and a way to make sure that you can do it safely for yourself is to make sure that you have a mask available. So I would recommend keeping these masks on a boat, keeping the one with you so that you can do rescue breaths without getting any vomit or anything on yourself. Because doing CPR on doing bystander CPR is not pretty. I've done bystander CPR where we didn't have a mask available, and we were not able to give rescue breaths because it was too messy and unsafe for the rescuers. So for a drowning victim, the rescue breaths are going to be the most important thing. So making sure when you're doing CPR at the scene that you're doing the 30 compressions to 2 breaths, and you can even start with breaths with this person, start with the 2 and then move on to CPR. Obviously you can't do CPR in the water because you don't have won't be effective. They don't have a hard surface. So again, moving that patient to a safe area. And then it's not uncommon for someone who is drowning to vomit after they have had that. So making sure to clear vomit out of the way, but foam is not the same thing. Foam is going to be normal. Foam just occurs because the water that they have in their lungs is going to interact with the surfactant, the lining around the lungs. So foam, you don't have to worry so much about that. It's more important to give breaths and give good compressions. If you see foam, vomit is something that can further block someone's airway, so clearing that out of the way is important. Other things to think about for management of an unconscious victim: do they have a visible injury that again could have led to them becoming unconscious and going into cardiac arrest? So do they have a head injury that you can see something visible that's bleeding? Could they have hit their head and lost consciousness? Do they have another bleeding injury? Is there blood in the water? Could they have become hypovolemic and lost a lot of blood and gone into cardiac arrest? So kind of some things to think about, that it may not be primary a drowning problem. Maybe they need another problem that needs fixing as well. And again, this can be obviously EMS would have been called. EMS can kind of manage these other things, but just kind of good things to note. Another thing that I've kind of have had to stress with people who are not in the healthcare system is kind of the difference between breathing and agonal breathing. Some people have wanted to stop CPR when they see agonal breathing, and just knowing and telling people that is not the same thing, and that CPR still needs to be continued if you're seeing kind of those weird gasping breaths that don't really seem like breaths, that CPR definitely still needs to be done. And then not trying to pump the stomach of someone who is drowning. This is kind of another common misconception, that people try to get the water out of a drowning person's stomach. But again, this is just going to make them throw up, possibly aspirate more water into their lungs or vomit into their lungs. It's not effective. Just focus on the breaths and CPR for someone who doesn't have a pulse. And then CPR and cooling. This is kind of an area that when I was looking at kind of drowning victims, kind of like an area that needs more research but might be interesting to note, because obviously with the conscious victim, you want to keep them warm so they don't get hypothermic. But part of our practices with someone who has been in cardiac arrest in the hospital is as soon as they get to the hospital, we put them on a therapeutic hypothermia protocol. So we try to keep them cool in order to preserve brain function. So if you are doing CPR on someone and they're wet and cold, it's probably not worth bothering to try to warm them up. Just work on the CPR and let other people kind of take over, because in the hospital they might try to cool them down anyways, because that has shown to be super effective in preserving brain function and helping someone to have a normal recovery afterwards. So again, this is something that needs more research, is kind of what people are saying right now, but it's something interesting to know of just, and might be good to just kind of focus on CPR of someone who is pulseless. All right, so I think that's it for drowning. Let's talk about some of these other injuries. So spinal injuries can happen when in water if people are diving into shallow areas or cliff jumping and haven't checked the area. So again, important kind of like scene safety stuff, and making sure if you're participating in this that you're always checking to make sure that your scene is safe before you do any of these activities. Making sure that you can get to someone safely and pull them out. If they're complaining of not being able to feel their legs, or numbness or tingling right away, that's kind of what we're looking for. Pain or tenderness along the spine, numbness, tingling, or even heat and cold sensations, because it kind of throws off your regulation of that area. Weakness or paralysis in any of your extremities. These are all kind of signs that we need to be really, really careful if we're moving this person from the water to the land. So trying to keep their neck and head straight as possible. This person is in a C collar and has kind of this full spine look. That's how we want someone to always look if we're worried about a spinal injury. And just kind of looking out for any of those injuries, or if they were jumping off a cliff and said they think that they hit the bottom. If they were diving, like, I think I hit the bottom, my head kind of hurts, my back is a little sore, that's another good indication that it might be a stable spinal injury. They might have pain and tenderness on the spine, but they might not on the spots. But if someone was cliff jumping and hit the bottom, that's a good sign that they probably need to be checked out, and they need to be very, very careful with their spine. Might need to stay in spinal precautions until EMS can get to them, because this might be a stable spinal injury where it hasn't severed the spinal cord. It's not going to cause any of those neurologic symptoms that we're looking at, like numbness, paralysis. But if it's not treated and protected, and their spine isn't protected, the bones could shift and could cause injury to the spine. And that would be the worst, if they were fine and then caused injury later. So just kind of being really, really precautious of this, and making sure that people are have practices that protect their spines. Those full spine precautions are going to be super important. Okay, and then we'll touch a little bit on hypothermia. Again, cold water is considered anything less than 68 degrees Fahrenheit. So that would be a lot of areas that we find here in Utah, especially like up in the high mountains where it's just complete snow runoff. So with hypothermia, you kind of go through these stages of first cold shock. If you were to go into cold water unexpectedly, fall through ice, be in icy water, you'll have like an initial cold shock where your body is kind of overreacts, hypermetabolic, start breathing really fast and hyperventilating, and that'll happen in the first minute, and it'll kind of stabilize as your body kind of somewhat gets used to the water. But then staying in the water for, and again, this is for ice water, so staying in the water for 10 minutes will lead to cold incapacitation. So that's going to be where you're unable to do any fine motor movements. Everything will be kind of big, and you'll be feeling weak within 10 minutes after that. And then it'll take about an hour for, I've heard 30 minutes to an hour for hypothermia to set in the cold water. And that can be the dangerous part. And then here, we'll talk on the next slide, we'll talk more about treatment, but this is just a picture of ways to treat someone who is hypothermic. So just making sure to apply heat to mostly the axilla is probably the most important. Axilla, chest, they have some on the shoulders there as well, because there's like blood flow going through the carotid artery. At least I think those are trying to touch on the carotid artery. And then kind of wrapping some up in a blanket, kind of like a sleeping bag. And then let's look at that next slide. So this is, sorry, hopefully this isn't too messy of a graphic. I had another graphic, but it was really complicated. So I just kind of, I simplified it a little bit and had to make it myself. So, and I'm not the prettiest at making graphs and everything. So here's a little flow sheet here. So this is kind of something, if you suspect hypothermia, kind of what measures should you take for that? So the first thing, if someone's saying they're cold, do they have a normal mental status? That's kind of the first thing we're looking for. Are they confused? Are they tired? Are they kind of are they drifting off, not paying attention to you? Things we're looking at there. If they do have a normal mental status, are they shivering? Let me move my little thing over here so I can see this side. Are they shivering? So that can be a sign of if your body is how it's regulating your temperature or not. So if they're not shivering and they have a normal mental status, they're fine. They're just cold. Just do things to, I don't know, heat up if it's bothering them enough. So cold stress is kind of the word for it. So, and just, you can do things to prevent that. Making sure you have insulation, vapor barriers to draw any sweat away from your body, things like that to prevent that cold stress. So if someone has a normal mental status and they are shivering, ask, are they functioning normally? Do they need assistance doing tasks? Like, are they shivering so bad that they can't function normally? If that's the problem, then if that's the problem and you answer yes to that, then they may have some mild hypothermia. And so kind of the ways you can protect from further cooling, which is using that insulation vapor barrier kind of area. So you want to make sure that they're not getting wet from sweat, that you're drawing sweat away from the body, drawing anything that could be wet away from the body with that vapor barrier. This is like a base layer that people wear, especially in the winter, like with skiing. Draw it away, and then you have that insulation to help kind of protect for more heat coming in. And then you can do some passive warming techniques, and this should help with mild hypothermia. So you want someone to keep shivering because that's your body regulating your temperature, and you support that by making sure they have a high calorie intake so that your body doesn't run out of energy with shivering. Have them drink a warm drink. And then active warming is also beneficial, and we'll talk about active warming more in the moderate hypothermia. Sorry, I have an extra arrow there with the normal function going to the no. If they're shivering but they have normal function, that is considered cold stress, not considered mild hypothermia. And that's usually like in the winter, what most people feel. But again, all these techniques can be used for kind of any type of cold or hypothermia. It's just as you progress, you need more aggressive treatment, but any aggressive treatment can be used for someone who is cold or mildly hypothermic. So let's go over onto like the other side of this. So if someone does not have a normal mental status, that's kind of where you're a little bit more concerned. So they're lethargic, they're tired, they're confused, they're just like they're distracted, they're not paying attention to you, something's off there, their memory's not good. So the question is, if their mental status is not normal, then you ask, are they shivering? And if they are shivering, then that is definitely a moderate hypothermia case. And so that's when you want to apply, you want to do active rewarming. And so that's when you're applying heat to the chest and axilla, like this picture over here. Let me go back to that real quick. Chest, axilla, and back are the most important points because it helps to warm your core. Most important points to apply heat. Groin and ankles, again, like less important, but those are areas where a lot of blood flow is going through, so that'll help to warm your body quickly. But if you had to focus on an area, focus on the chest and axilla for sure. And then they have this person wrapped up in kind of a burrito there. Can everybody else see this whole picture? Are you guys seeing my thing here? Okay, all right, cool. So let's go back to this. Yeah, so moderate hypothermia, we want to do that active rewarming. Using warming blankets. Oh, if you don't have, if you're wondering what to use for warming techniques, if you get like large water bottles and fill them with hot water, like I've used Nalgene bottles for just not being hypothermic, but cold stressed when my feet are cold in a sleeping bag. Get a hot Nalgene bottle filled with water, and use that and apply it to armpits, chest, back and shoulders. That can be used to help warm someone. And then you can also continue using the passive and protecting techniques. So making sure they have a vapor barrier, insulation, they're not wet. But because we're talking about water safety, that's going to be the biggest thing. So getting someone out of wet clothing and into something dry. You don't want to just take off wet clothing and be exposed to the environment with nothing on. That's not going to help at all. So making sure that you have something to change into that is dry, and that you have some kind of shelter available so that you're not exposed to the elements as well, because that'll still increase the hypothermia. So, and then again, or another important note with the moderate hypothermia, make sure this person isn't walking around and they don't use a hot bath to warm them. Walking and sitting in hot water will help to draw the heat to your extremities and your periphery, and it still leaves your core cold. So you need your core to be you need your core warmed up. That's the most important part there. So have them sit down until they're able to be warmed enough, because again, walking, that's going to draw any heat you have peripherally, and hot water that you're sitting in will also draw that heat peripherally. So then severe hypothermia, this is if someone does not have a more normal mental status and they're not shivering. So they've gone past that point where their body can try to regulate that. So then you're wondering if they're conscious. If they are conscious, that is still considered moderate hypothermia, and you still want to like really focus on those active rewarming techniques. If they are not conscious, that is severe hypothermia, and this person needs to be getting to a hospital ASAP. If they do not have a pulse, you can attempt CPR. It may be very, very difficult to do CPR because their chest will be hard and cold. And you just need to do all the other warming techniques. And in the hospital with someone who comes in with severe hypothermia, that's when we're doing aggressive, like warming fluids, giving them fluids that are warm, going in directly into the bloodstream. You can also do warm water bladder irrigation to try to warm their core that way as well. Lots of techniques to try to just warm their body there. But again, if you are in the field, kind of those active rewarming techniques are kind of the best thing to do for someone who's cold. Okay. Any questions on that presentation? I'll stop the screen share now.
All right, Linda, do we have a poll for in between, or we just?
You know what? I had it the reverse opposite. So we'll just go on and go right to Ty, and we'll use the poll at the very end, and we'll let Ty get on and share his wisdom with all of us for prevention.
We'll let Ty get on there, and like I said, I believe we have 2 polling questions then after he's complete. Is that right?
Or 3, but yeah.
Oh, 3.
Yep.
That's all right. Testing knowledge at the end.
Correct. Thank you, Kylie. That was fabulous.
Thanks.
Okay.
That was awesome. Thanks, Kylie. All righty. I'm just going to go ahead here and share my screen. All right. Everybody can see that?
Yep.
Okay. I know I can be a little dry and whatever else. So I'm just going to open up with some things here, or with one deal, and then we can kind of move along. Why does water never laugh at a joke?
Why?
It isn't a fan of dry humor. Okay, so there's a little bit of a pun. Sorry, just try to kind of get there. So anyway, I've really been into try to do the dry dad jokes type of thing. So I've been trying to do that. But this is really water safety, and this water deal is really nothing to be laughing about. It is quite serious, as Kylie talked about in the treatments and basically the end run result if somebody doesn't get the care or take care of themselves. So now I got to figure out how.
You go to the bottom of your slide, you can either press with your arrow to the next one, or you can go to the bottom of your slide. There you go, and do full right there.
There we go. All right. Sorry, I had a bar kind of kick it up there.
Yep.
So a big thing where I'm kind of focusing on and want to focus on is our natural water or our lakes and our reservoirs. They are much different than a pool. They are really very unsupervised. The supervision just goes to whoever is in care of the individuals there or the person that is out there for themselves. But our lakes and reservoirs, our rivers, they are so much different from pools. They have fast moving currents, waves, rapids, and then shallow water, and it can change. It just without somebody really knowing, and the visibility of being able to see the bottoms. The pool, you get to see the lane lines. I can't imagine swimming in a pool without seeing the lane lines. It'd be kind of hard on the head when you get to the other side, or you'd be going across lanes. So but anyway, that's the things that we need to be watching out. If you were standing in any type of water out in nature, to basically be careful of not to be knocked over by the wave or a fast moving current. It does not take much, and we probably have all experienced that one way or another. Hopefully a camera was never out to watch that fall or anything with us, but if it was, I'm pretty sure your friends will bring it out and show you every now and then, even your family. With that, but also with that, there are hazards. Those hazards can vary. Like in a pool, they talk about the drains. There can be several other little things, but you can see those. You stay away from them. They're kind of curious to the individuals in the pool. In a lake, it is not. Most of the time, you cannot see them. They are hidden. There are dams. They could be a low head dam on you as you're floating down the river. You can see. All of a sudden, there's something that changes. Low head dams, luckily we do not have many of them in this state, but they are present, and they can occur. A lot of time they're canals. I know right here close to us is the Jordan River, and we have a few places on the Jordan River that can trap somebody. So low head dams are really scary to be around. Underwater obstructions, logs, rocks. This could be man-made obstructions. Any type of debris that may be in there, and the vegetation. Drop-offs. We don't have the luxury of having the nice, gentle, gradual slope you see in a pool. Drop-offs can change within a matter of inches, a footstep, and it can go from inches, feet to 100 or more feet in change in depth. And then the other thing to be aware of is just other people's activities. You can see a little photo down here, some kids. We've got kayakers that are there. This area where this was taken is actually in a swim area, but a lot of times they're unregulated areas. You have boats that are coming in there, and if you're thinking of swimming out into a multiple use area that is not really protected, it is, and I will speak from experience of being a boat operator, you are very, very, very hard to see. It is one of my fears that if I do not see something or see somebody, that something could go wrong and possibly impact them. And I think that is something that you need to be aware of as a swimmer. A lot of times, swimmers and boaters, they share the same area, they share the same beaches, and so everybody needs to kind of keep their head on a swivel and be watching for themselves and watching for others. Let me move on to the next one here. This one I kind of pulled from a lady that I got to know. Her name is Dana Gage. She pulled this information from the CDC and put together this graph called the X effect. Connor was her child, her son, and she does a lot of speaking about drowning prevention, and also she does a lot of she speaks from firsthand experience of a bad interaction during her incident with Connor, and in dealing with the responders that were there, and how she was not giving the information. So there was some great information to kind of come out of this. But the pull with this is that as a child is younger, most of the time we go to pools with younger kids and we play in the pools and things. And as they get older, their risk reduces drowning risk reduces if they stay in that pool environment. But if we go out to a lake, the risk of drowning increases as age increases. And I will say from my experience, this is the truth. This is what I've seen over the 22 years that I've been out on the waterways and dealt with these incidents. This is what is occurring. So I think a lot of times it goes down to supervision, but it also goes down to two decisions, either as an individual or as a group. As Kylie talked about, and with cold water, Utah, on the most part, we are a cold water state. There are gradients. There can be temperature gradients that occur if you are vertical in the water, treading water. The surface can be warm. Mid-chest, it can start to lose a couple of degrees, and even by the time you hit your feet, you could have quite a variance in temperature with your water. So Utah is a cold water state, and also that those temperatures can change with different areas. That can change with currents. Also, there could be areas in a lake that do not have enough sun exposure and to be able to be solar heated up to be a little bit warmer. So cold water is something that we really need to be taking into effect. Even though our ambient temperature may be 100 degrees outside, our body temperature is 100 degrees. We can jump into something, let's just say 70-degree water with that. We are having heat withdrawn from our body because of that 30-degree temperature variance that we have there. And that water is surrounding us and can touch every bit of real estate that we have of our bodies and cool us very quickly with that. As was mentioned, Kylie mentioned a little bit about this. This is something that we try to tell people to talk to them about some safety. It is one thing that is hinged on wearing a life jacket, and I hit that a little earlier than I wanted to, but life jackets are very, very important with that. But this 110.1 saying, I think after this has been out and after the researchers in the medical profession have been able to vet this a little bit, I think there's been some modifications to it, but it is really solely dependent upon the water temp. This 110.1 kind of came from that 43 degrees to 45 degree water temperature when they did their studies. And so these are averages. This is all what it goes. But the one, let's see if I can, yeah, there we go. Went with there. We have 1 minute of that uncontrolled breathing. That's that cold water shock that kind of occurs in. We probably have all experienced that one way or another. I personally do not like it. But we either have had a sibling, roommates, or we have jumped, and some people actually love to get into the hot sauna and then jump or into the hot tub and then go into the cold water. Again, I don't react very well with it, so I don't like that with it, but I know where my limitations are. But you have that to where you do that gasping reflex and it's very, very uncontrolled. When this first came out, is like, you got 1 minute to control your breathing, and it's like, no, this is a physiological effect. You cannot control this. It will pass, but you need to know what is going on with your body. So that's what we're trying to say, is you're going to have this hyperventilation, this uncontrolled breathing for about 1 minute. It may go longer, it may be shorter, but it's going to occur. The 10 minutes of worthwhile movement. One of these things is when we talk about with boaters, we do a lot of times in the shoulder seasons of our boating season, and that is that in our spring and our fall, we start to see a lot of falls overboard and individuals experiencing this cold water immersion, and then they either struggle or cannot get themselves back to safety to reboard their boat. This occurs out on the reservoir. You start to, as we said, we lose the fine motor skills and even into some of the gross motor skills that occur along with that. And a lot of times it's scary when you start to see, especially the gross motor skills starting to go, the fines going. A lot of times it's hard to deal with the individuals and get them to safety. And that's one of the things that we need to make sure that we're very, very careful with. But if you've seen somebody, they're clawed up, their arms are like this, the gross wave basically is only like this, the deer in the headlight look, that's severe hypothermia. And you've got to be acting really, really fast. It's just one of the more scary times in my career of having to deal with a couple of victims that looked like that, and we were a long ways away from advanced medical to be able to get them transported to it. And then last of all, and I know that this one kind of has it, but it's up to an hour before the severe hypothermia sets in, and that's basically unconscious, becoming unconscious, and then at that point in time you would drown or perish at that time. But again, like I've said, this whole thing hinges upon life jackets with it. And I liked having this to come to a little bit brighter side, smiling kids on there. But these life jackets, to go back and to talk about the 110-1, has anybody ever tried to run and not try to make their breathing go into rhythm with their stride? They ask another question: has anybody tried to swim and not bring their breathing into rhythm? And so that's one of the things to kind of look at is that if that's the case, I shouldn't say if that's the case, but we can't really do a lot of our movements. We time our breathing with that. Swimmers time their breathing with their strokes. As you're running, I know that I run and I'm timing my breathing with my stride. This comes to treading water and into that swimming piece. So please, the item that I'm trying to get through this is when you're in that hyperventilation phase, that cold water shock phase, the life jacket is going to be the things that's going to keep your head above water before you can start to get your rhythm back to where you can start doing your worthwhile movement and to get yourself to safety. So life jackets, again, with these cute kids, there's a few of these life jackets that are a little too big for these kids. This was our assistant PIO took some family pictures of an outing, and he did put a little disclaimer in. So maybe with that, Jamie and Linda, I do have a little disclaimer on this. Is out of this one is that he tried to get a good picture, but some of these jackets are a little big for these kids. But
point taken. Point well taken. A comfortable fitting.
Yeah,
jacket.
they got to be comfortable fitting. They're not riding up around their ears. So the little guy there with the Liquid Force jacket, his is big. But we need to make sure that we have a Coast Guard approved jacket. And the reason why I say that is because that jacket has actually been vetted through and had tests done on it. It has to perform at a certain standard for it. Impact vests and other vests that you see, a lot of times we're starting to see these vests and they are really flooding the market. Wakeboarders and wake surfers absolutely love these vests because they're small, they're thin, we can bend, they're not bulky. But the thing is they have not been vetted. They may have been vetted by some professional wakeboarder or wake surfer, and they got their name stuck on it. The company's marketing it, and that's basically all that's happening. These ones have had a rigorous test that they have to go through and prove to the United States Coast Guard that these jackets can perform in these environments. And so that's why I asked to have that is a U.S. Coast Guard approved jacket. The next and probably one of the most important things is making sure that the jacket fits you. And then once that jacket fits you, does it fit you and is it comfortable? If it's not comfortable, this is frankly not our parents' times. We're not dealing with, or even earlier than that, we're not dealing with the big old Mae West K-Pox, the finest hours type of life jackets. If we saw life jackets in some of these old movies, or movies portraying old, a lot of the World War II movies and stuff, these big old life jackets that are on there. It's not that. It's not the cheap 4-pack of what we call either the horseshoe or the Gumby style orange life jackets. That's kind of the, what do you want to say, that's kind of the dork test out on the water. You got one of those. Get one that's I'm happy that people are wearing them. They work great. I'm not telling you they don't work great. They work awesome. But most people, as I said, they look at that and say, I'm not wearing that. I'll look like a dork. So that jacket's not going to do any good for that person with it. So something that's the right size, they're comfortable. And then next thing is I am guilty of it too. I know with my job, I've changed my perception on this. Open the jacket up and read the label. Read the label and read the instructions. That nice little piece that has a little plastic piece that goes through the belt. We all rip it off and throw it in the garbage can. Read that, because that tells you a lot about the jacket, how to take care of it, and what to do, and how to make sure you got it, how to properly don it and get it properly fit. But make sure that it's for the intended use, and they will say in there what they are what they are supposed to be used for, and what they should not be used for. Most of the time, we try to keep it in the man, I'm going to really get into the weeds on this one, because there's 2 different types of jackets out there. There are typing for jackets. There's the old 1, 2, 3, 4, 5 type of typing for jackets. And now, if you've gone to Costco, you started to see these weird little symbols, and it has a 50 and a 70 and 100. And that's more of an international deal, and it's performance level. That's like a whole nother lesson in itself. But the big thing is those jackets tell you what these jackets should not be used for, and the Coast Guard, the other one, says what they should be used for. So that's just some things to look at in reading those labels and understanding them. But the biggest thing is make sure something fits and it's comfortable. Learn how to swim is another thing that I think that to do, and I know that in the pools and a lot of these swimming schools, whether they be through a municipality or privately, the biggest thing that we're trying to push on to people is learn how to swim, and also to remember to just know how to swim with a life jacket, and to wear a life jacket. Swim with a buddy. We got the kids in here, we got their buddies in there. Don't go alone. And then do not swim during or after consuming alcohol. That just starts to play some different things with your body. So please be careful with that. The next thing is the life jacket does you no good unless you wear it. And I thought this was a great photo to kind of show this. This is a lot of times what we see. Somebody either rents, or they rent a paddleboard, they rent a kayak, they on the personal watercraft, and the life jacket is left on land, and they just want to get out in the water and go. And their most important investment that they could have invested in themselves that day, they left it back on land with it. So life jackets, again, like I said, is the most important thing that we can do for somebody to help you in that time of need if something does occur. Okay. Supervision. Supervise the swimmers. This is parents. Most of the time when we're in the pool, when you've got a small young one, we're with them, and we're watching them. We're trying to, but we're not trying to be, supervision is not being on the cell phone. It's not reading. It's not talking to other friends and family. And that's not sitting in a chair consuming alcohol. It's actively watching. In our lake areas and such like that, active watching of your swimmers will help and assist, and you can be able to coach somebody to bring them in closer to shore if they're getting further out, and also you can ensure that they are wearing their life jacket and not taking it off to do some funny little thing, whatever kids do, some funny things. And even adults do it too. So I think our big kids sometimes get even to doing things a little bit more extreme. Water rescue. I just kind of want to go through this. Kylie tapped on, touched on a few things with this, and I would love to see if I could take that and take a swing and knock this one out of the park for us both with it. But know what we need to do with rescuing somebody. First of all, the first thing that we can do is try to reach them. If we can be someplace in safety, and from a place of safety, and we can reach with a hand, we can reach with a towel, we can reach with an oar, a branch, shovel, anything like that, anything you can get. You gotta kind of turn in, and I'm going to show my age a little bit. You kind of got to turn yourself into a MacGyver and try to use anything and everything you can at your disposal to get there and to try to help that individual. Ladders, yeah, but be careful that doesn't pull somebody over. You've got to use your noggin a little bit on some of these reach things. But your reach. The next one in this is the throw. As Kylie talked about with the throw bag, these things are awesome. And you can reach a long ways. Most of these are geared up between the 50 to 70 foot, 75 foot length. So you can reach out there, not that full 75, but you can reach out there pretty close to 70 feet away from you. And this is a great way of doing it. And you want to make sure that if you are deploying one of these, that you know how to do it. Not to tie it off to yourself. And you know how to restuff the bag or to do a fast deployment if your first one doesn't work out. Also, we want to throw past. You want to throw maybe a little bit in front if you have a current, a little bit upriver if you have a current, so it will potentially drift towards them. And then also you want to go over them. You want to extend past them with that throw. The next one is row. If you have something that you can be capable with, and you can go out and help and provide a platform for them. Again, you need to be comfortable on this platform to where they are not going to overturn you or cause an issue with you in not being able to return back and effectively take care of this rescue. I will have to say that Sunday, I was responding to a recovery at Deer Creek Reservoir, this very unfortunate circumstance. But this was one that if this could have been exercised, we probably would not have had 3 people in peril, and potentially 4 people with one rescuer that went out to recover the other 3 that were there that went out on a kayak. And so we just need to be very careful with this one. Anytime that we are going into that environment, we need to make sure that we are wearing our life jackets. We know the capabilities of ourselves and capabilities of the craft that we can go and help them. And then last of all, with it, I say don't go for help. Make sure you know where that last point seen. That is mighty helpful for a time that if it does go into a recovery phase, that last point seen can cut down on time, and potentially we may be able, if the water is cold enough and the age is right, all the stars line up with this, we may be able to get this person to advanced care and have a successful recovery of this individual. So just remember that we have a reach, throw, row, and then go for help as we go through this. CPR, Kylie did, it was just great on that. I was nodding through the whole thing. In fact, I really would love to see some of your slides, and so we can pass this on to our field ranger, our rangers out in the field. But it's a great thing to learn, and it's as she had said, compressions, the CPR itself is wonderful to go with, but the rescue breathing is paramount. As she had talked about, where the oxygen levels and saturation in the body is just it's depleted, that you can do the compressions and such, but you're moving around unsaturated blood, and you're not going to be able to take care of that patient without giving those rescue breaths. So it's just one of those things that it's a messy thing being in the field with it. It is messy. It's not inviting to do it. So barriers are your greatest friend. Just take care of yourself, number one, but we want to take care and make sure that we can do the best we can for a patient that is out there. And then last of all, to hammer home one more time, we want people to wear their life jackets. So as we have with our symbol here, we want people to wear it in Utah. And I guess we got any questions?
Thank you, Ty. I'm just going to go ahead and go through both of the poll questions that we've done. I had them running while you were going since we were a little bit limited on time. I think that might be a great way. I'm going to end this poll and I'm going to share this one that we did. Everyone, can you see the results on there, Ty?
Yeah.
Okay. So how long does it take for severe hypothermia to set in? I think this was a little bit of a trick question, but as we stated together, you did have the 1, 10, and 1 based on the severity, but I think you reiterated that it really depends on the water temperature. Correct? Is that correct? And,
yes.
Yep. So I guess if it's 68 water temperature versus if it's 36 water temperature is going to make a big difference. So thank you on that. And then the next one is prevention of a water accident includes which of the following? This is also another one. All of these, you reviewed this in one of your slides. So if you chose just one of them, you're correct. But really all of the above, they're all important to wear what you had said, an approved USCG approved life jacket. Make sure people know how to swim, always swim with a buddy, not alone. And swimmers should be without distraction. So really all of the above. And I think that was you're correct, those of you who just did part of it, and this was great. The which rescue should not be implemented, the jumping in. So thank you for that. The only one I'm also going to quickly go over because there were some questions on that one. Let me see if I can get to the other poll. Relaunch polling, continue. Oh, I can't go back to the one I did a little bit before, but there was a question on, never swim alone. One of the questions, the number one priority, and I think your hit home one was the correct answer, which is highest priority is to wear a life jacket that fits.
Yes.
So some people had put in don't go swimming alone, which is also important. But really, it's if you do go alone or someone does ever go alone, to have that life jacket on body. It was a take-home message that we heard.
Yes.
Does anybody else have any questions? You can put something in the chat. If you did miss getting your poll questions, just go ahead and put your email. I actually see who it's from, Wendy. No worries about it. We'll make sure that you were on the whole time. I know that you were on the whole time, and you'll be excused from those polls right now. If there's anyone else who did not have a chance to answer the polls, please feel free to put your name in the chat, and we'll make sure that you can get your contact hours. Any other questions for anyone? Awesome, Jamie. No questions, thank you. Ty and Kylie, thanks so much. Jamie, do you have any other end of comments?
I was just going to say thank you very much, Ty and Kylie, for taking the time to present today. And then you have some people just saying thank you from a former lifeguard and paramedic. Great review from Florida, so good job. Thank you, Terry. And thank you to all of you guys for staying on, giving us a little bit extra of your time. And hopefully we will see you all again in 2 weeks for boat safety, and then hopefully for trauma grand rounds in July. But let me know if you guys have any questions. Feel free to email me at any time. And again, thank you, Ty. Thank you, Kylie, so much.
Yes, and anything, if you wanted to put out there, if there's any question or any boating related thing for just preparation of coming up for the next presentation, please get a hold of Jamie. She can probably that'd probably be easy. Pass it on to me, and I'll make sure that I address that in this next presentation.
Yep.
Excellent. Thank you so much for your time. It
you.
was really a
Thanks,
great
everybody. It was
presentation by both of
fantastic.
you.
Yes, great review.
Yeah, thanks for coming, everyone.
Thank you.
Okay, so I'm going to go ahead and close the meeting, and you'll get your certificates in the next week or so. Thank you. Bye-bye.
Bye, everybody.